Hello and welcome to the Tower Hamlets Trauma-Informed Community of Practice for November 2025. I'm Angela and I'm one of the co-chairs of this group. And I'm really excited to have Megan joining us, Megan Keenan from Dartington, to come and give an update on the Trauma-Informed London project that's been going on. And we heard from Megan, I think it was a few months ago, maybe, or earlier this year. So it would be great to learn more about the progress that's gone on and what we might be able to take forward in Tower Hamlets. So, Megan, I'm happy to hand over to you.
Perfect. Thank you, Angela. And I have my washing machine going, so if you hear a loud buzzing in the background, let me know. Um, and I've got some slides that I'll share. We presented just a little bit of a background. We launched this work at City Hall last week on Wednesday. So this presentation has a bit of that information alongside kind of more just general details because this is a not so formal setting. So if people have any questions, feel free to just ask questions while I present. I'm sure we can discuss after as well. All right, I'll attempt to see if I can share these slides. Okay. Let's see. My name is Megan, and I am a systemic change lead at Dartington Service Design Lab. Dartington is a charity that works for systems change for children and young people across the UK. We've been working with the London Violence Reduction Unit as a part of this work probably over the past year and a half, and have, like I said earlier, we've launched this work last week, which I'll explain soon. It comes with a kind of a suite of outputs, including some work that it was happening in Tower Hamlets specifically as well. So really excited to be able to share this today. And also, like I'll say in a bit, but this is just the kind of the launch, the start of something. So we see this as very much so a first step, an initial kind of starting point that's built off of a history of work that's happened in London as well. And many of you are part of that work already. So just a thank you for that and kind of a reminder that this is just the beginning. And I apologize about the way that my slides are being presented right now. So let me see if I can just go to the next slide. So there we go. So what did we do? So this work set out to build a shared citywide understanding of trauma-informed practice. Like I said, to kind of lay the foundations for meaningful system-wide change. At the core, they were focused on kind of several things. First was to create a consistent vision and definition of trauma-informed practice, then to identify and elevate existing examples of promising trauma-informed practice across London, which I'll explore in a second, and then also work to strengthen London's collective capacity in delivering trauma-informed practice as a way to reduce violence, as this was in partnership with the London's Violence Reduction Unit. So this project focused on statutory partners across policing, health, and local authorities mainly, but it was also working alongside voluntary and community sector organizations, the education sector, and then we also worked alongside some young people to share learning around current approaches and what was needed to be changed in London as well. This work was also driven by 16 champions who are part of our core champions group. And they were from policing, health, local authorities, voluntary service organizations, education, and young people, just kind of like the sectors we were working with. And together we worked to co-develop this project's definition of trauma-informed practice, the vision of where we're going, the direction, and kind of built off of all of the experience of that group. So it was definitely this kind of massive collective undertaking. And beyond the work that we did with them, we also worked alongside We also engaged over 300 professionals across London's public services. And some of the activities that we did to include that was we first started off with kind of initial stakeholder interviews, getting an understanding of what trauma-informed practice looks like in London. We did a rapid literature review to understand trauma-informed practice, both in a local context and a more national context, also grounding an understanding of trauma-informed practice through the lens of anti-racism and anti-oppression. We did a baseline survey across policing, health, and local authorities to understand what current practice looks like in London and what are the needs. Then we did a series of workshops that helped to kind of fill gaps within that survey and talk to people directly. And then from that, we identified some 6 core case studies to highlight what good practice looks like in London and built all of kind of the insights into this and some of our research outputs and reports. And then we did a bit of a study tour in the spring that shared some of the insights from the case studies, brought people together across London, and helped us to kind of get more insight on our research and ensure that everything was kind of resonating across London as well. So within all of this work, something that we ensured was part of the process is putting equity at the center, thinking around trauma-informed practice, not just as a training or kind of a activity that's added on or maybe a tick box to check. It was really around how are we thinking around organizational cultures, how are we thinking around the experiences and histories of people living and working in London, and how do we think of trauma-informed practice as something that could be embedded in a more structural way. Um, so now in my little slideshow here, I'll walk you through a couple of kind of the core insights that have come out of some of that work. So first, our definition of trauma-informed practice in London. So like I said, this was co-designed through our Champions group. And how we define trauma-informed practice is an approach designed to recognize, understand, and respond to the profound impact of trauma on individuals, communities, and systems. It aims to embed this awareness across relationships, policies, and services, fostering supportive and safe environments that actively prevent re-traumatization. Then our vision from this work is for a connected London where choice and agency are embedded in everyone's experience, a city that nurtures, strengthens, and sustains us, where we build people up and bring barriers down together. So again, really thinking around elements of kind of collective responsibility, thinking around the barriers to trauma-informed practice, how are we shifting them, and also, thinking around what we can do in a more collective, holistic way across London. So it's not that there's just pockets of practice that's happening kind of across the city. Then we developed these 6 core case studies, which I'll share a link. It's all hosted on a website, and you can see it in a much more beautiful version than my PowerPoint slide that I'm showing right now. But just to give you an understanding of who's highlighted in the case studies and why they're in that space, we first have Enfield, which is focused on embedding trauma-informed practice across schools and settings. So it's a partnership between the council, kind of psychological mental health services and education settings within Enfield. Within Tower Hamlets, we highlighted elements of this practice, thinking around kind of more grassroots ways of bringing people together, sharing around trauma-informed practice alongside some of the work of the council and public health teams and piloting and testing different programs and the lessons learned from that. We also highlighted Lewisham's youth justice service trauma-informed, anti-racist, and restorative approach called Tiara that they've been implementing for the past 10 years, and they've seen it really transform their youth justice service. We've highlighted our Operation Soteria, which is a case study that comes from policing that's focused on re-centering and changing how police respond to victims and survivors of sexual violence, and some of the different ways that they've been doing that, alongside some of the challenges that have come across with that work. Um, we also highlighted the London Vanguards, which is more of a health ICB focused example, which was thinking around their kind of trauma-informed, integrated, kind of community-based approaches to working with young people. And then the last one is Divert, which is a program that takes place within youth justice settings. It's connects young people to coaches, and they have a really central trauma-informed practice as a part of their model. And so we've highlighted some of the learning that comes from that as well. So this is a resource that is now available for everyone. Hopefully they're quite easy to read, like 5 pages that outline what they're doing, what are kind of the drivers that are related to how their practice has created change around trauma-informed practice, and what it means to do this. And the intention was we wanted this work to be really grounded in like practical approaches to trauma-informed practice in London, and not just kind of a report that sits on a shelf. So that is available now, and I'll share a link soon. But before I do that, I wanted to just go over a little bit more on what we've learned from this process now that I've described a bit of how we did it. So like I've mentioned that our understanding is that, trauma-informed practice manifests not only within, or sorry, trauma manifests not only within individuals, but also across generation or across communities and cumulatively over generations. So without addressing deeply rooted structural harm, systems and services in London risk reproducing trauma, eroding trust, and pushing people away from needed support. We also risk burning out our workforce, which is something that we kind of saw come up a lot in this work, deepening inequalities and losing confidence in the communities that we serve. And I think alongside this work, I think we've seen even in the past couple of months, a long historic but rising need in thinking around mistrust, thinking around how some services might perpetuate trauma within London, and how are we responding to this in a way that people can feel and see the change. So while the urgency for trauma-informed practice remains, we've also learned through this work that there is good practice that is happening within London. So organizations and individuals across London are embedding trauma-informed practice in a lot of ways across the city, and that the lessons learned from this work help us to understand where we can scale practice, where we can share examples of learning that can help to reshape systems to heal instead of harm. And so just an example from this work is the Lewisham Youth Justice Service that I mentioned. They've been embedding this trauma-informed anti-racist and restorative approach in their work since 2017. And they've described to us how it's really shifted the culture of their ways of working. So they call it TIARA, which is the acronym. And actually, I spoke to someone last week who's a psychologist, clinical psychologist, that's a part of their team, and she was describing that, at the beginning of every meeting, they'll kind of say that this meeting is going to follow a tiara kind of ways of working and general kind of standards, so that people are really thinking around trauma-informed practice and anti-racism at the center of kind of everything that they're doing. So it really shifted a lot of the ways of working. But one of the things that they've done through this work is really centering a holistic understanding of young people and the systems around them, which has then achieved a marked and sustained reduction in custodial sentences and a significant reduction in the use of remand in Lewisham, which was historically kind of young people were overrepresented within that system, and particularly Black and mixed heritage young people in Lewisham. And now they're seeing almost no young people have to go through the justice system in the same way, which is a really transformative impact. And while this is just the impact of the encounters in the justice system, it isn't just about that. It's also about the transformative impact that it has on the young people themselves and centering them. And so this approach has been kind of felt by young people, community staff, and it's really increased kind of a sense of trust within the team. There's been a kind of a lot of a sense of pride in the work that they're doing, less burnout. People have been staying on the team, that people have left and come back to join the team again, and they've seen just that it's really had a big impact in what they're doing. Um, I think I have a quote here. Yeah, so this was from one of the interviews that we had with one of the youth justice workers in Lewisham, and she was talking to us around how they've changed the way that they do their pre-sentencing reports. So it's a lot around changing the language around how they describe young people that are within these settings. So they always start off with a positive statement about a young person, and they always work to contextualize their experience within justice settings. And she described how a lot of the young people that they see have not really experienced people with, especially within kind of services, having anything really positive to say about them. And just through doing that, kind of reframing how they're speaking with young people. They've seen transformations in the outcomes in justice settings as well, alongside kind of building trust and much needed relationships with the young people that they're working with. So just wanted to highlight that story. Um, and then this kind of brings us to the drivers of change. So, kind of one of the core insights of this work was thinking around what are the things that need to be invested in order to create sustained change for trauma-informed practice in London. This is actually the thing that I presented on a couple months back, and we've kind of revised it through a lot of work with a lot of different people. And we've kind of narrowed it down to these four drivers of trauma-informed practice in London. And the idea is that if we're able to put attention and focus into some of these drivers, that we'd see sustained change. So it's kind of beyond just looking at, how many people are engaged within a training, like it's thinking around kind of more of those deeper rooted structural drivers for change for trauma-informed practice. So I'll just go through that uh, quickly. But the first driver is about building trust in relationships. So, as you probably all know, trust is foundational for trauma-informed practice and is built through relationships that center consistency, transparency, and listening. And this means meeting people and collaborating organizations where they are, moving at the pace of trust, and elevating and valuing the diversity of different lived experiences. And for example, in Divert, which was one of the case studies that I talked about, this included their long-term commitment to supporting young people through a one-to-one coaching model that prioritized consistency, strong relationships, and recognition of each young person's unique context and lived experience. And it's also reflected in the program's decision to operate without rigid time limits. So it meant that young people could access their services for however long they needed and whenever they needed them. So they didn't kind of put a time limit on when they could access that support. The second driver that we found through this work is psychological safety and supporting psychological safety. So for safe and effective trauma-informed practice really depends on both staff, the people delivering it, and the communities themselves feeling safe. And so this means creating environments where people can speak openly about their experiences, where workloads are manageable and allow for time where it's needed, and where support's built in. A lot of teams have seen a big impact of having kind of separate reflection spaces with their teams, thinking around psychological support that can happen in different spaces, and having the time to do that effectively. So in the case of Operation Soteria, they've worked to create consistent, non-judgmental, and emotionally safe support for victims and survivors of sexual violence in London, and having psychological support with the officers that were working with them as well. And where they've been able to do this, it's helped to kind of mend trust and support that process to make it feel safer for everyone that's been involved in the process as well. So, and I think we've seen that kind of across all of the different examples and the people that we spoke to in London as well. Um, then our next driver for trauma-informed practice, we've called fostering a culture of curiosity. So this means, well, fostering a culture of curiosity means working with individuals, organizations, and communities to shift how we understand behavior, bringing an anti-oppressive, anti-racist, and holistic focus in trauma-informed practice. And it includes understanding people in their wider context, challenging stigma, and embedding reflection and learning into practice. I think that kind of building on the example of Lewisham, we've really seen that when they kind of changed their ways of working and embedding this kind of holistic lens, grounding it within an understanding of layers of and systems of oppression and the ways in which services might be interacting with that. They're able to see a transformation in how they're responding in a trauma-informed way, and we see that as really central to this work. And the last driver of trauma-informed practice is called reimagining practice. And we see that real change for trauma-informed practice in London requires often rethinking the structures, practices, and power dynamics that can reproduce trauma. And so from our research, we've heard from people around calls for reimagination, courage, and partnership to design new ways of working that's rooted in equity and shared purpose. And in practice, kind of like fostering a culture of curiosity, it means disrupting harmful systems, developing shared language and values, innovating and testing new approaches, and building bridges across organizations and communities. So rethinking kind of how we're doing our work collectively. And this has been exemplified by the London Vanguard teams who are working as a part of this project with integrated care boards across London. And one of the examples was around how they're transforming their referral systems. So this can happen in big ways and it can also happen in smaller ways. I think transformation of referral systems can also be quite a big undertaking as well. But something that they did was thinking around how the referral systems often felt really form heavy, impersonal, bureaucratic, not fit for purpose. It meant that young people who may have wanted to access support felt like that was a barrier for them, or maybe felt like it was a barrier for them sharing it with friends or family who might need to access the support. So what they did is they created parallel referral pathways to their services, emphasizing the value of peer referrals and young people that could refer themselves or families just through text, word of mouth, or more informal community channels. So it was thinking around how do we reshape services that center what young people or the people that we're working with need and remove barriers for them, rather than kind of thinking from the organizational standpoint and the processes that kind of hold the tick boxes of what an organization might need. So kind of rethinking who's centered within in that support. So through that, and I'm almost done here, but we've also developed this roadmap. So and there's a lot of detail on this page. It's all linked into a website that I'll share shortly. But the idea from this work was to not necessarily build a framework, because I think we've seen lots of different frameworks for trauma-informed practice and don't necessarily need to add anything to the mix. But it was thinking around how do we take some of the learning that we've built from this work, those drivers that I just described around trauma-informed practice, and then some practical recommendations for what trauma-informed practice could look like into a central roadmap. And this is sat alongside London's Violence Reduction Unit. And the idea is that the VRU is now kind of holding this work and responsible for taking this forward. And so Here you can just see a bit of an example of some of the recommendations that we have alongside the drivers of change and where that fits and who these recommendations are for. I won't go into all of the detail of this just because it's all kind of outlined in the website. But the idea is that we want to just outline some of these practical steps for creating sustained change and ensuring that there's accountability within that process as well. So yeah, we've done that to kind of overlay a bit of a roadmap for what this work looks like. Um, so I think that is a bit of an overview of what we've done and where we've gotten to since I last spoke to you all. That is a QR code to the website, but I'll also just drop a link in the chat right now. So I'll stop sharing my screen and really open to any questions that people might have. Let me link the website here. Um, and yeah, apologies about about the slides and the deck, but hopefully that kind of covers a little bit of an update of what we've done.
Great, thank you so much. And yeah, the link has come through. Slides were great, still very visible, so all good. And you really summarized like a whole ton of work so succinctly, so appreciate that. Um, and yeah, I think it's so exciting to know that this is still a priority for London, because it's been going on for quite some time and there's been a lot of effort over the years from different folks. So it's nice to kind of see it being almost like rebooted in a way, with a roadmap. Um, I was wondering if you could say a bit more about kind of the next steps from, I suppose, especially from like a GLA perspective, but
Mm.
anything like that that was coming out from the event that happened last week or that we can, I suppose, expect from government going
Yeah.
forward, if there is anything to say yet.
No, that's a fantastic question. I think that was kind of a lot of the central part of the launch event at City Hall last week as well. So kind of like I said, we wanted this event that we had and then this research to be kind of more of a launch than a celebration of anything that is finishing. So it's really a bringing together of a lot of work, like you said, that's already happened, naming what might need to be done in order for this to be sustained, and kind of recommending who should be doing that and who should be leading it. So,
Mhm.
Lib Peck, who is the director of London's Violence Reduction Unit, was there at the event and closed the event for us as well. And she kind of set the tone that, the this is, the real work basically starts now.
Mhm.
So we can't just kind of stop that. Have a resource that can then be sat on a shelf. And especially from London VRU's perspective, I think it's really important that this is actually kind of something that is committed to and financed and resourced. I think one of the big barriers that a lot of people were discussing within the event was that there's often, I think, a lot of, or there can be a lot of people with goodwill, and we've seen that. Like a lot of the people that are driving trauma-informed practice forward are often doing it in their own time or in addition to the work that they're doing, or are facing a lot of kind of structural barriers to what this practice can be, and the yeah, and we want to see a shift from it being something that is seen as an add-on to something that is seen as foundational to
Mhm.
the work of people in London. But we know that can't just happen by us saying that it needs to happen, right?
Mhm.
Um, so yes, I think I think the VRU now feel a bit of maybe fire under their feet for committing
Mm.
to something. I think Lib said that next year will be the real test to see where they've come from, and this work is something that came out of the mayor's office as well. So I think that's something that hopefully we can see as, strategic priority. But I would say the specifics of what it looks like are yet to be defined. And I think definitely open to ideas, further ideas beyond the recommendations of how we can make sure that it's happening. So yeah.
Great. Okay, that sounds promising. Excuse me. I think especially, and people feel free to come in if you have ideas or thoughts on that. I don't know if this was shared by other areas across London or like centrally, but my sense in Tower Hamlets is that like it's currently quite a challenging
Mm.
time to be working in the public sector. There's a lot of challenges with resource constraints. There's a lot of change going on constantly that is felt by people working across different teams and services. The changes happening, for instance, in the NHS and the ICB,
Mm.
with like the idea of kind of doing some things strategically feels very difficult.
Mm.
So I guess I wonder if that part was expressed or acknowledged in that event or has been like across the people that have been involved in the project, because it seems like, and also not to mention the kind of changes politically, and like especially for people that are particularly already traumatized. So
Mm.
like, of course, people that are seeking asylum,
Yeah.
or experience kind of racism and bigotry, it's already not usually a great time, but particularly currently it's uncomfortable, to say the
Mm.
least. I
Mm.
don't know if that came up in that setting as well.
Yeah, no, definitely. And I think
Mhm.
we had a panel, and there was a lot of questions on what policing's going to be doing as well around this. I think, you know, there's so many things that feel like speaking from my experience as someone who lives in London as well, but it feels that, things aren't really getting much better. It feels like kind of increasingly quite a scary and traumatizing, re-traumatizing environment. And I think we know that there's a long-standing history within the Met of being named institutionally racist, and then also the BBC Panorama as well that recently came out around the way that some of the officers were working. I think that we named that in the room as well. And I think there's a lot of kind of the need for things to feel different and structurally quite different and trauma informed in a way that is not reproducing trauma, and looking around, really addressing structural harm is kind of central to what we see as really important in this work. And then I think, yeah, I think that, but at the same time, I think there's definitely like a lot of, it seems like, barriers to doing that within kind of public services right now. And I think thinking around different funding structures, kind of the different way, kind of quickly shifting priorities of what is important and kind of who is important within this work and navigating that landscape. So yeah, I guess maybe that isn't like a full answer, but an agreement of why it's really important. Yeah.
Fair, yes. I guess it's something that you just have to uh, name out loud
Yeah.
for it to be addressed. So, and you kind of highlighted that in one of the drivers, in terms of psychological safety.
Yeah.
So that feels important. Okay, well, thank you. I think, do people in the room have questions or comments about the presentation or about the kind of wider sense of what's happening in London?
I do, if
Great,
that's
come on
okay.
in.
Yeah.
Hi, Angela, Megan. I was wondering, once there is a plan for implementing an approach that permeates down to,
Mm.
reduce violence, to contribute to social justice, to have better services and so forth, I think that apart from the culture, like you were saying at the Met Police and so forth, like the culture that needs to change, I think perhaps it needs to be considered, or it must have been, that many of the people who perpetrate violence or sort of support social injustice are themselves traumatized. And so when you start to implement a system, say, how can you ask somebody to become more fair and informed if they haven't resolved trauma themselves?
Yeah. No, definitely. And I guess I think maybe that's the idea is around, especially around thinking about that kind of further contextualization, psychological safety and support that is hopefully intended to kind of look beyond yeah, I guess quite a holistic lens to this would mean that when we're thinking around, for example, within policing, like we need to think around how police officers are getting re-traumatized within their work and what kind of support they're receiving to manage that trauma and kind of process what's happening and having a bit of like slowing down. I think time is a thing that feels that's really pressured all of the time, and there's a lack of space that is kind of given for people to process things that might be happening within work or within life, and then that can kind of risk reproducing trauma or acting in ways or in ways that can create harm. And so I think there's an idea that same holistic lens could, if applied kind of everywhere, hopefully would have an impact of reducing trauma for people living and working in London in a lot of the different ways that it shows up. But always at the same time really centering like who it is that feels unsafe, what are kind of these histories of kind of structural trauma that has existed, and not shying away from that at the same time. But I think, yeah, there's definitely a need to holistically look at that for everyone. Yeah.
So,
Yeah,
so
thank you.
tricky.
Yeah, go for it.
Yeah, go for it.
No, I just agree. It's just quite a massive endeavor because,
Yeah.
where do you start? I guess you're gonna start by the people that represent all those services and so forth, but really aware that they're probably traumatized and have been brought up in a culture that says it's normal to then go and repeat.
Yeah, it's such an important point. And I think like when you were speaking, it made me think about, people that you might, I might, I'll just talk about myself. You might view someone as like racist or, exhibiting harm, but that it's coming from a place of like feeling unsafe and kind of working with where that comes from. And that, not to say that that's any individual or like organization's responsibility, because it is meant to be something that's shared. So like I'm encouraged by the idea that this is kind of being seen as a like London-wide concern and initiative, because it's too much for kind of one organization to hold by itself. And yeah, the examples with the police are important too. Thanks, Lydia, for putting in the chat. I'm just going to read it out loud, and you're welcome to come in if you'd like. A major barrier we have in London is working across borough lines, especially for children living in care of a local authority but housed in a different borough. This makes it very tricky for agencies to work successfully together, and there are always uncomfortable discussions about how services for these children are paid for / provided. These are some of the most vulnerable children we have, but their care is directly impacted by systems and commissioning structures that are very outside of our control. That's a difficult one.
Yeah.
I don't know, Megan, if you have anything to add to that or what
Yeah.
you'd like to say.
Well, no, definitely. Thank you, Lydia. I think I would definitely echo that came out so much in the research and the people that we're speaking to as well, that there's a lot of barriers that are created in a way that come through different ways of working, different like borough lines, what resources people can access because they're within a certain space or they fit a certain criteria. And I think um, that really fed into the vision that came out of the Champions group was kind of underlying having a more connected London. That is kind of the idea is to work across kind of those borough lines, but at the same time, you know, like I said, a vision is something that we need to work towards. I think one of the ways that we're hoping and one of the recommendations from this work where we can see changes is how do we build on more collective working across London. So that would mean thinking around, and hopefully the VRU can carry this forward. So we had this champions group that was a part of our work that was kind of sitting across London. There's a core group, but there's a lot of people in that group that are doing trauma-informed practice, really committed to sustaining that work moving forward. Obviously, this is an example of a group like that, but potentially at like a strategic level across London services, there could be more spaces of people coming together consistently thinking around implementing more trauma-informed services and practices, which hopefully could then kind of think around those structural barriers that are created across borough lines and across policies that could be shifted to create the differences and experiences for people. But yeah, I think definitely there is a need to see how are we not sticking services and work into specific places and how that can be such a big barrier for people and also can be quite traumatizing in itself. But yeah, thank you.
Thanks. I'm glad there is some thinking around that brewing. I just wanted to flag two things in the chat. One that I already posted, so if you scroll up, do find the feedback form link because it's always helpful for us to understand how you're feeling about these sessions and things that you want to hear in the future. But another one that I want to post is on behalf of Muslima, who was the presenter from our last session, which is about the Women's Commission and the next session that you are welcome to attend. It's a public review on women's safety in public spaces, and that's on the 9th of December. Just wanted to kind of interject to make sure I don't forget about those. But I suppose, are there any other questions or comments from people in the room about things that they're excited to hear from the presentation or other concerns and gaps that they've observed in relation to what Megan's shared? If not, hopefully it's been some good food for thought and maybe a bit of comfort to know that there's still work going on in this space. Because it can be easy to feel like you're the only person that wants to push this forward when you're working in a culture where that doesn't seem to be the case. So on that note, I'm excited to share the slides and the link with everybody after the session as well. And I think it would be good even for me to bring it to our kind of public health leadership team to see what we think our role is taking this forward. So thanks, Megan, so much for making the time to present this. And yeah, I think it's really important for us to kind of stay on top of this in Tower Hamlets. It's a tricky time and we need to work together.
And I'll definitely share updates with you on what the VRU is kind of doing to take this forward as well, and opportunities that might arise from that. So I'll make sure to keep everyone in the loop in that space as well.
Great, thank you. I'm just gonna stop